Hello again, everyone. Dr. Tony here for our wonderful week 3 in Psych 316 Counseling Psychology. Let's again move to our little screen share here and open up to our counseling for week 3. I'm going to call this our journey. We've been through week 1, we've been through week 2. We've looked at different theories. We're starting to develop our own theoretical basis and our way of meeting the client where they are. So let's continue our journey. So today I want to talk briefly about knowing your limits, developing your theoretical basis, addressing the limits using solution-focused theory to help you and your patients, and also getting into supervision and your own therapy. And I always like to tell my supervisees, don't forget the malpractice insurance. All right, let's talk about knowing your limits in developing your theoretical basis. When we do this, we're talking about, again, in week 1, we talked about boundaries in general. So this is extremely important. When you're developing your theory, when you're developing your theoretical basis, understand that any theoretical basis, no matter how long they've been in practice, it's a journey. It's an ongoing process. You'll always take your theory and you're always going to change it. You're going to look at it. You're going to meet the signs of the times. You're going to meet the people where they are. Your thought processes are going to change. At least I hope they do. Because the more that you treat patients, the more you change. You're going to learn a lot from your patients about yourself, about how to treat people. That's what's going to drive you. That's what's going to drive your practice. And that's what's going to drive you into becoming a better therapist and a better counselor. If it doesn't happen that way, you're in the wrong field. Because when you do psychotherapy, when you do counseling, whatever you want to call it, when you do this, you're helping other people and you're growing. You're growing. This is going to help you get to know you better. This is going to get you to explore yourself better. And this is also going to get you to explore your patients and have them explore things better. We talked in our last week about 6 different theoretical ways of dealing with therapy, right? Some of these were motivational interviewing, cognitive behavioral, Gestalt, client-centered, right? We talked about this stuff. Well, as we pull all these together, you've got to be able to focus these into what you believe counseling is. By this time in your studies, you should already have in your mind, this is what I'm thinking. This is what I want to do. You know, I like this part of client-centered because it works. I'm able to engage the client and I get the point where they have to drive themselves and I can't give them an answer, but it doesn't help me all the way in being the counselor I want to be, because part of me wants to be able to give them work to do, because maybe you're in recovery and you did your own work and you found that very effective. So you want to draw from cognitive behavioral, but you don't want to be as stone cold as cognitive behavioral is. Go home, do this work, and bring it back to me next week. Maybe there's another way you can do that. So you use your client-centered theory and you blend the cognitive behavioral into that, et cetera, et cetera. You know what I'm talking about. We discussed this last week. But with each of these things that you're going to do, there are limits to it. There are limits to it. You can't do everything. And sometimes it's going to fall flat, folks. That's right. Sometimes it's just going to fall flat. It's not going to work. Does it mean you give up? Absolutely not. It means that what you have to do is explore it a little bit more and explore it through your patients. Oh, this didn't work for you. Could you tell me where it fell short? How come this didn't work? Well, so you did what I told you to do and it didn't work. Based on that, what do you think might work for you? Could we talk about that? You have a session talking about what works for the patients. And then you sit there and you say, well, why don't you go home and try that for this week? So you've taken your theoretical basis and you've expanded it. You've taken your theoretical basis, you've tied a little bit of Rogerian therapy in there and also CBT, give them a little bit of homework assignment and give you a little chance of some of their negative thought processes that they've done, and you've pulled them out of it. But know your limits. And when you develop your theory, understand that it's an ongoing process. There's a lot of things you need to look at. Your patient, the family, the system they work in, the environment that they live in, society in general, the politics of the society in general, their theological basis, that's right, their religion goes into that as well, their belief system there, how they use their higher power, all of that. Address the limits. And as you address the limits, you want them to come up with a solution. So you're going to dialogue with the person. And when they come back to following the week, you sit there and you say, what worked for you? This is where solution focused therapy comes in. What worked for you? How did you solve the problem? Talk to me about the steps that you've used. Come up with a solution, not just an answer. Anybody can come up with an answer. It's the solution that you want to come up with. So you talk to them about it. Tell me what the solution was. Tell me how you worked through it. Take notes. And as you take notes and you work them through it, you get them to learn a little bit more about themselves. And then you get to learn a lot about you as a therapist and as a clinician, because you can use solution-focused therapy in your own practice to grow as a person as well. Think about these different things that you can do. Here's a problem. Here's how you work through the problem. And this is the resolution to the problem. So you have your problem, your process, your solution. And as you work through all of that, you're using these different techniques on your basis of thinking of things, whatever you want to call it. Now, as you work through this, you're going to find that some of these things that you do may work, may not work, and you're going to find yourself bugged. Really, you're going to find yourself bugged. It's going to bother you. You may lose sleep over it. You may not lose sleep over it, but it's going to start to work on you a little bit. Don't go crazy. You're okay. This is why I tell students one of the things you need to do when you're learning about your limits, whenever you're treating patients, you get into your own psychotherapy. I do. When I treat patients, I call my insurance company up and say, I want a psychotherapist. And I tell my insurance company exactly what kind of therapist I want. They give me a list. I choose. I interview the therapist. And then I might meet with them for one session, say, thanks a lot, but, you're not for me till I find the one that I want. And I tell the therapist, look, this is what I'm dealing with. I'm treating patients, and I want to look at my own transference and countertransference issues that I may have. And I want to be able to work through them, and I want to get to know me more so that I can become a better therapist. Oh, let me tell you, if I had clinicians come to me and I was their therapist, I would love that, because it gives me a chance to explore them a little bit more, gives me some ideas of where they are and where I am, then we can work through it. Also, it's a good dumping ground for you, because one of the things you don't want to do in your practice is take work home with you. That's very dangerous and not very good. That's how relationships are lost. That's how divorces happen, right? That's how, if you're in recovery, that's how you relapse. Don't do that. What you want to do is you want to find a way to handle your situations at work that affect you outside of that in a safe, confidential way. Also, if you have your own therapist and you're doing this, you can also see how your therapist works as you start to develop your own theory. See how your therapist works. Talk to your therapist about it. Now, when you're in therapy, can you talk about your patients? Absolutely, you can. Remember, it's all confidential. You don't need to mention your patient's name. Oh, I got this patient, John Jones. No, you don't want to do that. But you can sit there and you can say, I got this patient, I'm going to call him Ralph. At least that focuses you. Now, Ralph could be the patient's name. It may not be the patient's name, but you mentioned something. Okay. And you talk about the patient, you talk about how it affected you in that session. Not what you did in the session, how it affected you, what the patient said, what the patient did. This is how you take care of yourself. This is how you start to know your limits in the session. Okay? You learn about yourself. Get yourself into supervision. Get yourself into your own therapy. It's very, very important. A therapist should always have a therapist. A supervisor should always have a supervisor. And it flows that way. When I do clinical supervision on people, I do clinical supervision. I got my own supervisor that I go to, and I'll sit there and I'll talk to her. Hey, I had this in session today. This is how I approached it. What do you think? Can I do it another way? What that does is it sharpens my skills as a supervisor. It also gives me a chance to bounce things off of another supervisor, so I can integrate maybe what that person has into what I do. The other thing that I want to talk about, the final thing for this, and I put it there not tongue in cheek either, malpractice insurance. This is something that usually is not talked about in sessions or in education. Well, I'm going to talk about it for a few minutes here and close with it. Malpractice insurance is something that we all have. You need to find your own malpractice insurance company. There's plenty of them out there. Just go to your browser and type in malpractice insurance for a drug and alcohol counselor. If you're a member of CCAP or a member of CADI, you can contact them. They have a magazine called the Counselor Magazine, CCAP has, and the Counselor Magazine has these different insurance plans. You can go to your own insurance agent and talk to your own insurance agent if you've got, I don't know, State Farm or whatever it's called. Ask them, I'm a counselor. I'm not a licensed psychologist, marriage and family therapist. I'm a counselor. I do drug and alcohol counseling. Do you have a program for insurance for drug and alcohol counselors? You're going to find that it's cheaper. When you do your internships, if you have an internship to go to, you're going to find that it's best to have your own malpractice insurance. Companies cover them. Companies all have to have malpractice insurance. I've never trusted it because the malpractice insurance for company covers the company. You're under their umbrella. But if you do something wrong, believe me, that malpractice insurance may or may not help you. You get your own. It's, as I said, it's not expensive. I pay about $285 a year for mine. My wife, who's a psychiatrist, pays about $4,000 a year for hers. Big difference, right? Hopefully, it's an insurance that you never have to use. You want a $1 million, $3 million policy with a $25,000 cap or more for sexual misconduct. I'm not intimating that you're going to be sexually misconduct in your practice. Not at all. It's just a safeguard because your patients can do anything that they want. You need to protect yourself. All right? So that's all I've got for today. Know your limits. Understand where you are. Understand who you are as a therapist. Build your practice based on different theories, theoretical basis, theoretical practices. Work with your clients. Get to know yourself a little bit better. Better yourself as a therapist. Working with your clients is usually a really good practice to do. Understand yourself. Try to find solutions to problems that come up. Don't come up with excuses. Come up with solutions. Get yourself into supervision. Work with a really good supervisor to hone your skills. Constantly do your studies. And again, don't forget your malpractice insurance. All right. So given all that stuff, I thank you again for this week. Good luck in your studies. Continue going. Again, reach out to me at Dr. Tony Scuderi, 916-767-7876, or anthony.scuderi@intercoast.edu. Your phone call, drop me an email, and we'll get back to you as soon as I can. All right? Good luck. Thank you. Let's move on to our next week. See you soon.